African College of Health. Program, Postgraduate Diploma in Tropical Medicine and Hygiene, DTM&H. Course, Child and Public Health in the Tropics. Children living with HIV. An estimated 1.7 million children aged 0 to 14 were living with HIV at the end of 2018, and 160,000 children were newly infected. An estimated 100,000 children died of AIDS-related illnesses. To reduce HIV-related mortality and morbidity among this highly vulnerable population, early testing and treatment is essential. Without access to testing and treatment, 50% of children with HIV will die by the age of 2, and 80% will not live to the 5th birthday. Diagnostics. World Health Organization recommends that infants born to mothers living with HIV are tested for HIV by 2 months of age, during breastfeeding, and when breastfeeding ends, given continued risk of transmission during this period. Older children, especially offspring and siblings of persons infected with HIV, should also be tested in high-prevalence regions. Community-based outreach and testing can improve access to testing while mitigating HIV-related stigma. Treatment. HIV-positive children should be started on antiretroviral drugs, ARV, immediately. Yet in 2018, almost half of all children living with HIV were not taking ARVs. Once treatment begins, children must take their medicine regularly to stay healthy into adolescence and adulthood. Failure to suppress the HIV virus remains a serious problem among children, aggravated by a lack of child-friendly formulations of the newest and most effective ARVs designed for adults. With 1.6 million living with HIV, 190,000 newly infected and 33,000 AIDS-related deaths, adolescents face additional barriers in accessing testing and treatment, including health services that are not adapted to the unique needs and rules that require parental consent for services. HIV-positive adolescents also are less likely than adults to adhere to the treatment regularly, resulting in lower rates of viral suppression and lower declines in mortality. Peer-driven and adolescent-friendly services, integrated with other services including psychosocial support, are effective ways to improve health outcomes for adolescents. Control programs. World Health Organization develops normative guidance on HIV prevention, testing, treatment, and care, and works with policymakers and program managers to promote their rapid adoption and implementation. Join us at web links. Thanks and welcome again. Stay safe. Africa.